Q1. A young woman gets admitted with abdominal pain, vaginal bleeding. Nurse should consider an ectopic pregnancy. Which among the following is not a symptom of ectopic pregnancy? Pain at the shoulder tip. Dysuria. Positive pregnancy test. Q2. Which is the safest and most appropriate method to remove hair pre-operatively? Shaving, clipping, chemical removal, washing. Q3. Now the medical team encourages early ambulation in the post-operative period. Which complication is least prevented by this? Tissue wasting, thrombophlebitis, wound infection, pneumonia. Q4. Reason for dyspnea in patients who diagnosed with glomerulonephritis patients. Albumin loss. Increase oncotic pressure causes water retention in cells. Albumin loss causes decrease in oncotic pressure causes water retention causing fluid retention I alveoli. Albumin loss has no effect on oncotic pressure. Q5. Olivia, a 75-year-old patient from a nursing home, was admitted on your ward because of fractured neck of femur after a trip. She will require an open reduction and internal fixation, ORIF, procedure to correct the injury. Which of the following statements will help her understand the procedure? You are going to have an ORIF done to correct your fracture. Some metal screws and pins will be attached to your hip to help with the healing of your broken bone. The operation will require a metal fixator implanted to your femur and adjacent bones to keep it secured. The ORIF procedure will be done under general anesthesia by an orthopedic surgeon. Q6. As a registered nurse in a unit, what would consider as a priority to a patient immediately post-operatively? Pain relief, blood loss, airway patency. Q7. Safe moving and handling of an anesthetized patient is imperative to reduce harm to both the patient and staff. What is the minimum number of staff required to provide safe manual handling of a patient in theatre? 3. 1 either side, 1 at head. 5. 2 each side, 1 at head. 4. 1 each side, 1 at head, 1 at feet. 6. 2 each side, 1 at head, 1 at feet. Q8. When an oropharyngeal airway is inserted properly, what is the sign? Airway obstruction, retching and vomiting, bradycardia, tachycardia. Q9. An unmarried young female admitted with ectopic pregnancy with her friend to hospital with complaints of abdominal pain. Her friend assisted a procedure and became aware of her pregnancy, and when the family arrives to hospital, she reveals the truth. The family reacts negatively. What could the nurse have done to protect the confidentiality of the patient information? Should tell the family that they don't have any rights to know the patient information. That the friend was mistaken and the doctor will confirm the patient's condition. Should insist friend on confidentiality. Should have asked another staff nurse to be a chaperone while assisting a procedure. Q10. What do you have to consider if you are obtaining a consent from the patient? Understanding, capacity, intellect, patient's condition. Q11. Recommended preoperative fasting times are 2 to 4 hours, 6 to 12 hours, 12 to 14 hours. Q12. What are the principles of gaining informed consent prior to a planned surgery? Gaining permission for an imminent procedure by providing information in medical terms, ensuring a patient knows the potential risks and intended benefits. Gaining permission from a patient who is competent to give it, by providing information, both verbally and with written material, relating to the planned procedure, for them to read on the day of planned surgery. Gaining permission from a patient who is competent to give it, by informing them about the procedure and highlighting risks if the procedure is not carried out. Gaining permission from a patient who is competent to give it, by providing information in understandable terms prior to surgery, allowing time for answering questions, and inviting voluntary participation. Q13. Postpartum hemorrhage. A patient gave birth via NSD. After 48 hours, patient came back due to bleeding. Bleeding after birth is called postpartum hemorrhage. What type? Primary postpartum hemorrhage. Secondary postpartum hemorrhage. Tertiary postpartum hemorrhage. Lochia. Q14. When do you gain consent from a patient and consider it valid? Only if a patient has the mental capacity to give consent. Only before a clinical procedure. None of the above.
Please don't forget like and subscribe. Thank you.
Q15. Who should mark the skin with an indelible pen ahead of surgery? The nurse should mark the skin in consultation with the patient. A senior nurse should be asked to mark the patient's skin. The surgeon should mark the skin. It is best not to mark the patient's skin for fear of distressing the patient. Q16. Gurgling sound from airway in a postoperative client indicates what? Complete obstruction of lower airway. Partial obstruction of upper airway. Common sign of a postoperative patient. Q17. An 18-year-old 26-week pregnant woman who uses illicit drugs frequently, the factors in risk for which one of the following: spina bifida, meconium aspiration, pneumonia, teratogenicity. Q18. What is not a sign of meconium aspiration? Floppy in appearance. Apnea. Crying. Q19. If a client is experiencing hypertension post-operatively, the head is not tilted in which of the following surgeries? Chest surgery, abdominal surgery, gynecological surgery, lower limb surgery. Q20. What does assessing for no refusal means? That the person has not already refused treatment. That the person cannot or is unable to refuse treatment. That the person does not already have an advanced decision. The person is already detained, being treated under the Mental Health Act. Q21. Which of the following is a potential complication of putting an oropharyngeal airway adjunct? Retching, vomiting, bradycardia, obstruction, nasal injury. Q22. The signs and symptoms of ectopic pregnancy except vaginal bleeding. Positive pregnancy test. Shoulder tip pain. Protein excretion exceeds 2 g a day. Q23. A patient doesn't sign the consent for mastectomy, but bystanders strongly feel that she needs surgery. Allow family members to take decision on behalf of patient. Doc can proceed with surgery, since it is in line with the best interest and outcome. Respect patient's decision. She has the right to accept or deny. Q24. You are caring for a 17-year-old woman who has been admitted with acute exacerbation of asthma. Her peak flow readings are deteriorating and she is becoming wheezy. What would you do? Sit her upright, listen to her chest and refer to the chest physiotherapist. Suggest that the patient takes her Ventolin inhaler and continue to monitor the patient. Undertake a full set of observations to include oxygen saturations and respiratory rate. Administer humidified oxygen, bronchodilators, corticosteroids, and antimicrobial therapy as prescribed. Reassure the patient, you know from reading her notes that stress and anxiety often trigger her asthma. Q25. Accurate postoperative observations are key to assessing a patient's deterioration or recovery. The Modified Early Warning Score, MUSE, is a scoring system that supports that aim. What is the primary purpose of MUSE? Identifies patients at risk of deterioration. Identifies potential respiratory distress. Improves communication between nursing staff and doctors. Assesses the impact of pre-existing conditions on postoperative recovery. Q26. A client is brought to the emergency room by the emergency medical services after being hit by car. The name of the client is not known. The client has sustained a severe head injury, multiple fractures and is unconscious. An emergency craniotomy is required. Regarding informed consent for the surgical procedure, which of the following is the best action? Call the police to identify the client and locate the family. Obtain a court order for the surgical procedure. Ask the emergency medical services team to sign the informed consent. Transport the victim to the operating room for surgery. Q27. Common minor disorder in pregnancy. Abdominal pain. Heartburn. Headache. Q28. How soon after surgery is the patient expected to pass urine? 1 to 2 hours. 2 to 4 hours. 4 to 6 hours. 6 to 8 hours. Q29. A patient is scheduled to undergo an elective surgery. What is the least thing that should be done? Obtain the patient's understanding of, and consent to, the procedure, and a share in the decision-making process. Ensure preoperative fasting, the proposed pain relief method, and expected sequelae are carried out and discussed. Discuss the risk of operation if it won't push through. The documentation of details of any discussion in the anesthetic record. Q30. Margaret was screaming in pain later in the day despite the PCA institute. You refer back to your nurse in charge for a stronger painkiller. She refused to call the doctor because her pain relief was reassessed earlier. What will you do next? Continue to refer back to her until she calls the doctor. Encourage Margaret to continuously use the PCA. Give Margaret some sedatives to keep her calm. Wait until her pain stops. Q31. A client diagnosed of cancer visits the OPD and after consulting the doctor breaks down in the corridor and begins to cry. What would the nurse's best action? Ignore the client and let her cry in the hallway. Inform the client about the preparing to come forth next appointment for further discussion on the treatment planned. Take her to a room and try to understand her worries and do the needful and assist her with further information if required. Explain her about the list of cancer treatments to survive. Q32. You are the nurse assigned in recovery room or post-anesthetic care unit. The main priority of care in such area is keeping airway intact, keeping patient pain-free, keeping neurological condition stable, keeping relatives informed of patient's condition. Q33. A patient is being prepared for a surgery and was placed on NPO. What is the purpose of NPO? Prevention of aspiration pneumonia. To facilitate induction of pre-op meds. For abdominal procedures. To decrease production of fluids. Q34. What serious condition is a possibility for patients positioned in the Lloyd-Davies position during surgery? Stroke. Cardiac arrest. Compartment syndrome. There are no drawbacks to the Lloyd-Davies position. Q35. You are looking after a postoperative patient and when carrying out their observations, you discover that they are tachycardic and anxious, with an increased respiratory rate. What could be happening? What would you do? The patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. The patient is demonstrating symptoms of atelectasis. Administer a nebulizer, refer to physiotherapist for assessment. The patient is demonstrating symptoms of uncontrolled pain. Administer prescribed analgesia, seek assistance from medical team. The patient is demonstrating symptoms of hyperventilation. Offer reassurance, administer oxygen. Q36. Mary was admitted to your ward with severe bleeding after 48 hours following her labor. What stage of postpartum hemorrhage is she experiencing? Primary, secondary, tertiary, emergency. Q37. What is right in case of consent among children under 18? Only children between 16 to 18 are competent to give it. Parents are responsible to give consent with children. Children who are intellectually developed and understand matters can give consent. Q38. You went back to see Mr. Bond, who is 1 day post-herniorrhaphy. As you approach him, he complained of difficulty of breathing with respiration rate of 23 breaths per minute and oxygen saturation 92% in room air. What is your next action to help him? Give him oxygen. Give him pain relief. Give him antibiotics. Give him nebulizers. Q39. The night after an exploratory laparotomy, a patient who has a nasogastric tube attached to low suction reports nausea. A nurse should take which of the following actions first? Administer the prescribed antiemetic to the patient. Determine the patency of the patient's nasogastric tube. Instruct the patient to take deep breaths. Assess the patient for pain. Q40. Patient is post of repair of tibia and fibula. Possible signs of compartment syndrome include numbness and tingling, cool dusky toes, pain, toes swelling. All of the above.
Please don't forget like and subscribe. Thank you.
Q41. A patient has just returned from theatre following surgery on their left arm. They have a PCA infusion connected, and from the admission, you remember that they have poor dexterity with their right hand. They are currently pain-free. What actions would you take? Educate the patient's family to push the button when the patient asks for it. Encourage them to tell the nursing staff when they leave the ward so that staff can take over. Routinely offer the patient a bolus and document this clearly. Contact the pain team anaesthetist to discuss the situation and suggest that the means of delivery are changed. The patient has paracetamol QDS written up, so this should be adequate pain relief. Q42. A patient is assessed as lacking capacity to give consent if they are unable to understand information about the decision and remember that information. Use that information to make a decision. Communicate their decision by talking, using sign language, or by any other means. All the above. Q43. Which of the following is not a risk factor for ectopic pregnancy? Alcohol abuse, smoking, tubal or pelvic surgery, previous ectopic pregnancy. Q44. A patient has just returned to the unit from surgery. The nurse transferred him to his bed but did not put up the side rails. The patient fell and was injured. What kind of liability does the nurse have? None. Negligence. Intentional tort. Assault and battery. Q45. Which of these is not a symptom of an ectopic pregnancy? Pain, bleeding, vomiting, diarrhea. Q46. Lisa, a working mother of 3, has approached you during a recent attendance of her daughter in accident and emergency because of an acute asthma attack about smoking cessation. What is your most appropriate response to her? Smoking cessation will help prevent further asthma attack. Referral can be made to the local NHS Stop Smoking service. Discuss with her the NICE recommendations on smoking cessation. It is not common for people like her to stop smoking. Q47. The following must be considered in procuring a consent: accept, respect and support people's rights to accept or decline treatment or care. Withhold people's rights to be fully involved in decisions about their care. Be aware of the legislation regarding mental capacity. Gain consent before treatment or care starts. Q48. A young mother who delivered 48 hours ago comes back to the emergency department with postpartum hemorrhage. What type of PPH is it? Primary postpartum hemorrhage, secondary postpartum hemorrhage, tertiary postpartum hemorrhage. Q49. Your patient has bronchitis and has difficulty in clearing his chest. What position would help to maximize the drainage of secretions? Lying on his side with the area to be drained uppermost after the patient has had humidified air. Lying flat on his back while using a nebulizer. Sitting up leaning on pillows and inhaling humidified oxygen. Standing up in fresh air taking deep breaths. Q50. An adult has been medicated for her surgery. The operating room (OR) nurse, when going through the client's chart, realizes that the consent form has not been signed. Which of the following is the best action for the nurse to take? Assume it is emergency surgery. The consent is implied. Get the consent form, have the client sign it. Tell the physician that the consent form is not signed. Have a family member sign the consent form.
Please don't forget like and subscribe. Thank you.